We're back now with Dr. Darien, taking a look at some of the questions that you are asking, especially when it comes to our health. And here's one from Kristen W. Is there a connection between thyroid issues and anxiety?
Great question from Kristen. So the answer is yes. An overactive thyroid can often be a cause or a reason why someone might have uncontrolled anxiety or even new symptoms of anxiety. So what do I ask patients to look for? It's the other symptoms of an overactive thyroid, which can include palpitations, feeling like your heart is beating out of your chest, unexplained weight loss, even symptoms like brittle skin, brittle nails, or even thin skin. If you have those symptoms coupled with new anxiety, then you should talk to your provider about getting worked up for the possibility of having an overactive thyroid.
All right, your prescription for wellness.
It's about stress. We're going to talk a lot about it in the coming days. I think it's important because TMJ, which is temporal mandibular joint disorder pain, is jaw pain. It can cause a tremendous amount of discomfort, especially when you're under stress. So we want to talk about some basic things that you can do to prevent that symptom. The number one thing that you can do is practice good posture. I know it might sound obvious, and also we'll skip to this one. I'm thinking about posture because I'm sitting in a certain position, but we'll start with avoiding chewy foods, things like bagels, tough meats like steaks. That can increase your symptoms and even provoke a TMJ attack or pain. And then back to posture, you want to make sure that you're sitting up, because a lot of the times when we're hunching or we're slouching, our jaw comes forward and that can provoke those symptoms. And that posture is even important when we're sleeping. Try sleeping on your back. This is very difficult and requires work. I know it personally. And then lastly, managing stress. Incorporating daily meditation, mindfulness, even trying things like yoga can not only alleviate your TMJ symptoms, but other symptoms associated with stress.
I love how I started out asking questions and you're talking about your posture. I'm like, okay, let's fix it.
We got to fix it together.
All right, Doc, thank you. And folks, we would love to hear from you. So please hit us up on Instagram with all of your medical questions for Dr. Darien at ABCGMA3.